Transcutaneous pacing. Definition. Transcutaneous cardiac pacing is a temporary method of pacing that may be indicated in patients with severe symptomatic or hemodynamically unstable bradyarrhythmias. Advantages. It can be established very quickly. It is easy to perform and requires a minimum of training. It can be initiated by nurses, paramedics, and doctors while waiting for expert help to establish transvenous pacing. Disadvantages. The pacing impulse stimulates painful contraction of chest wall muscles as well as causing some direct discomfort. Indication. It is particularly helpful in patients with reversible or transient conditions, such as digoxin toxicity atrioventricular block in the setting of inferior wall myocardial infarction, when transvenous pacing is not immediately available or carries a high risk of complications. Contraindication: severe hypothermia, asystolic cardiac arrest, especially if the resuscitation efforts were delayed for more than 20 minutes. Technique. Explain patient the purpose of the procedure, the equipment used. The procedure may cause significant discomfort and pectoral muscle twitching from the high voltage required for external pacing. Skin preparation. Remove excess chest hair from the skin where the electrode pad is to be applied. Make sure that the skin is dry. Attach ECG monitoring electrodes and leads. Requires intravenous analgesia and/or sedation. Electrode pad position. For right pectoral apical positions, place one electrode over the right pectoral muscle, just below the clavicle. Place the apical pad in the mid-axillary line, overlying the V6 ECG electrode position. For AP positions, place the anterior electrode on the left anterior chest wall, beside the sternum. Place the posterior electrode between the lower part of the left scapula and the spine, at the same horizontal level on the trunk as the anterior electrode. Rate. Select an appropriate pacing rate. This will usually be in the range of 60 to 90 minutes, one for adults. Output. If the pacing device has an adjustable energy output, set this at its lowest value and turn on the pacemaker. Gradually increase the output while observing the patient and the ECG, typically with a current of 50 to 100 mA using a device with adjustable output. Successful capture. Successful capture is usually characterized by a widened QRS complex, followed by a distinct ST segment and broad T wave. The only sure sign of electrical capture is the presence of a consistent ST segment and T wave after each pacer spike. Complication pacing threshold may increase with prolonged pacing, serious skin burns, failure to capture pain and discomfort. Thank you. For more nursing-related videos, please subscribe, like, and press bell icon.